You can take your medication every day, avoid obvious junk food, and still watch your blood pressure stay higher than it should. That surprises people, because it feels like you're doing what you're supposed to do. I'm Dr. Warren Hung, and if you're over 60, this is one of the most common situations I see. People are careful. They're not careless with their health. But their blood pressure remains stubbornly elevated, and the reason is often not where they're looking. If you want clear, practical explanations like this, especially around blood pressure, circulation, and aging, consider subscribing. My goal here is simple: help you understand what actually matters, so you can protect your health early. Now, here's the part that's easy to miss. The issue is usually not just what you would call a bad diet. It's the quiet patterns inside a normal diet that begin to matter more after 60. And that change is not small. As we get older, the body handles salt, fluid, and vessel tension differently. Arteries become less flexible. The kidneys become less efficient at regulating sodium and water. Hormonal systems that control blood pressure, especially the renin-angiotensin system, become more sensitive and, in some cases, more reactive. So the same eating habits that felt harmless at 40 or 50 can start pushing blood pressure higher at 60 or 70. But because those habits feel normal, they don't raise concern. That's where the problem begins. One of the most common misunderstandings is this: I don't eat that much salt, so my diet shouldn't be the issue. But blood pressure is not controlled by one visible factor like salt alone. It's influenced by a combination of patterns: how often you eat processed foods, how your body responds to sugar, how your kidneys handle fluid, and even how your meals affect hormone signals throughout the day. And many of these influences are not obvious when you look at your plate. Another form of false reassurance is simply feeling fine. High blood pressure does not usually cause pain. It does not announce itself clearly. You can feel normal, function normally, and still have constant pressure inside your blood vessels that slowly damages them. Over time, that pressure affects the lining of arteries. It makes them stiffer, it increases the workload on the heart, it places strain on the kidneys, and it raises the risk of stroke, heart attack, and long-term circulation problems. What makes this more concerning after 60 is that the body has less reserve. When you're younger, your vessels can adapt more easily. Your kidneys compensate more efficiently. Your system absorbs small mistakes without immediate consequence. But later in life, the margin for error becomes smaller. So, something that seems minor, a certain type of food, a daily habit, a pattern repeated over years, can have a much stronger effect than you expect. And this is exactly why many people end up in a confusing situation. They're doing what they believe is healthy enough. They're not overeating. They're not obviously making extreme choices. Yet their blood pressure remains elevated. That disconnect creates frustration. And often, it leads to one of two assumptions. Either, my body is just getting older, this is inevitable, or the medication should handle it. But neither of those fully addresses the root of the problem. Medication can help control blood pressure, it can reduce risk, and for many people, it is necessary. But if the underlying dietary patterns continue to push pressure upward, then the medication is working against a constant background force. That's why, in clinical practice, you'll often see patients whose numbers improve partially, but not fully, until those hidden dietary factors are addressed. And those factors are rarely extreme. They're usually quiet, repeated, and familiar. Things that don't feel dangerous. Things that don't look like mistakes. Things that have simply become routine. And that's what we're going to focus on. Because once you understand how these patterns affect your body, especially after 60, you can begin to make small adjustments that have a meaningful impact on blood pressure without needing drastic changes. And just as important, you can stop relying on signals that don't actually reflect what's happening inside your body. But once you start looking at blood pressure through this lens, a different pattern begins to appear. And the first hidden dietary driver is often something people believe is completely under control. The first pattern almost always starts with something people feel confident about. Salt. Not because salt doesn't matter, it does, but because most people believe they've already handled it. They stop adding salt at the table, they avoid obviously salty snacks, and from that point forward, they assume sodium is no longer a major issue. But the body doesn't measure salt the way we think about it. It responds to total sodium exposure across the entire day, and much of that comes from foods that don't taste particularly salty. 1. Hidden sodium in normal foods. Bread, soups, sauces, packaged meats, ready meals, even certain breakfast items, these can carry significant amounts of sodium without drawing attention to it. In data from the Centers for Disease Control and Prevention, A large portion of daily sodium intake comes from processed and packaged foods, not from salt added during cooking or at the table. And this matters more after 60. Because the kidneys, which help regulate sodium and fluid balance, become less efficient over time. They don't clear excess sodium as easily. That means more fluid stays in circulation. More fluid inside blood vessels means more pressure against the vessel walls. And over time, that steady increase in pressure contributes to arterial stiffness and higher baseline blood pressure. What makes this especially deceptive is that the food doesn't feel excessive. A slice of bread, a bowl of soup, a sandwich. These look like ordinary, reasonable choices. But when repeated day after day, the total sodium load builds quietly. Many patients say something similar when we review their diet. I don't add salt to anything. And that may be true. But when we look closer, the sodium is already built into the foods themselves. And this illustrates something important about how the body works. Blood pressure responds to patterns, not intentions. Even small amounts, repeated consistently, can create a sustained effect. 2. Sugar and refined carbohydrates driving pressure up. The second hidden driver is less obvious because it doesn't sound directly related to blood pressure. Sugar, and more specifically, refined carbohydrates foods that break down quickly into glucose. White bread, pastries, sweet drinks, certain cereals, and many packaged snacks fall into this category. These foods don't just affect blood sugar, they influence how the body handles fluid, hormones, and vascular tone. When glucose rises quickly, insulin rises as well. Insulin is a hormone that helps move glucose into cells, but it also affects the kidneys. It signals them to retain more sodium. So now, even if your sodium intake is moderate, your body is holding on to more of it. At the same time, repeated spikes in blood sugar and insulin contribute to what we call insulin resistance. That means the body needs more insulin to achieve the same effect. And higher insulin levels are associated with increased activity in the sympathetic nervous system, the part of the body that raises heart rate and constricts blood vessels. So now you have two things happening together: more fluid retention and tighter blood vessels. Both of these increase blood pressure. Large population datasets, including analyses from NHANES, have shown links between high intake of added sugars and higher blood pressure, even when controlling for other factors. Again, the pattern is what matters. Not one dessert, not one piece of bread, but the repeated rhythm of how the body is being signaled throughout the day. This becomes more significant after 60 because metabolic flexibility decreases. The body doesn't adjust as quickly, it doesn't recover as efficiently from spikes. So what used to be tolerated starts to have a lasting effect. 3. Healthy processed foods that disrupt balance. The third driver is one of the most confusing. Foods that are labeled or perceived as healthy but are still processed in ways that affect blood pressure. Low-fat products, certain heart-friendly packaged foods, ready-made meals marketed as balanced, or convenience foods designed for ease rather than simplicity. These often contain combinations of hidden sodium, refined carbohydrates, additives that affect fluid balance. And because they carry a health label, they lower suspicion. People trust them. They feel like safe choices. I remember a patient in his early 70s who told me he had cleaned up his diet completely. He had switched to low-fat ready meals, whole-grain packaged snacks, and pre-made soups he believed were heart-friendly. His intention was correct. He was trying to protect his health. But when we reviewed the details, his daily sodium intake was still high. His meals were still causing repeated glucose spikes, and his blood pressure remained elevated despite medication. What this shows is not a lack of effort. It shows how easy it is to miss the underlying pattern, because the label doesn't always reflect the physiological effect. And the body does not respond to labels, it responds to composition. After 60, this becomes even more important. Because your system is less forgiving. Small imbalances, slightly higher sodium, slightly more fluid retention, slightly more vascular tension accumulate more quickly. And they don't cancel each other out. They reinforce each other. That's why someone can feel like they are making good choices and still see numbers that don't improve. But even when these first patterns are addressed, there are still deeper dietary signals that continue to push blood pressure upward. And those are often the ones people never think to question. Even after people begin to reduce obvious sources of salt or cut back on sugar, there are still deeper dietary signals that continue to influence blood pressure. These are less visible. They don't stand out as mistakes. But physiologically, they change how your blood vessels behave, how your kidneys regulate fluid, and how stable your pressure remains throughout the day. 4. Not enough potassium to balance sodium. Most people think of sodium as the main dietary factor in blood pressure, but sodium does not act alone. It is balanced by potassium. Potassium helps the body relax blood vessels and encourages the kidneys to excrete excess sodium. It acts almost like a counterweight. When potassium intake is adequate, the body has a better ability to regulate pressure. When potassium is low, the effect of sodium becomes stronger, and this imbalance is extremely common. Diets that rely heavily on processed or packaged foods tend to be high in sodium and low in potassium. Fresh foods, vegetables, fruits, legumes are the primary sources of potassium, but they are often underrepresented in daily meals. Clinical recommendations, including those from the American Heart Association, consistently emphasize increasing potassium intake as part of blood pressure management. But here is where the misunderstanding happens. People may not feel like they are lacking anything. They may eat regularly. They may feel full. They may even believe they are eating balanced meals. Yet the mineral balance inside the body is still shifted in a way that promotes higher pressure. After 60, this imbalance becomes more significant. Because the vascular system is already less flexible and the kidneys are less efficient at correcting excess sodium. So without enough potassium to assist in that process, the body holds on to more fluid and maintains more tension inside the vessels. This is not about extreme deficiency. It's about a quiet imbalance that persists day after day. 5. Meal timing and late-day eating patterns. The fifth factor is not about what you eat, but when. Blood pressure follows a daily rhythm. Under normal conditions, it tends to decrease at night during sleep. This nighttime dip gives the cardiovascular system a period of relative rest. But certain eating patterns interfere with that rhythm. Late evening meals, especially those high in sodium or refined carbohydrates, can keep the body in a more active, stimulated state. Insulin remains elevated. Fluid retention may increase. The nervous system stays more engaged. As a result, blood pressure does not drop as it should overnight. Over time, this pattern, often called non-dipping, has been associated with higher cardiovascular risk in studies referenced by organizations like the European Society of Cardiology. And again, this becomes more relevant with age. Sleep becomes lighter. Hormonal rhythms shift. Recovery during the night is not as robust as it once was. So the timing of meals starts to matter more than it did earlier in life. What makes this difficult to notice is that the effect is not immediate. You don't feel your blood pressure staying elevated overnight. There is no clear signal. But the body experiences it repeatedly. And over time, that pattern contributes to sustained elevation during the day as well. How these patterns work together. Individually, each of these factors may seem small. A little more sodium than expected. A little less potassium than ideal. A slightly later dinner. None of these feels dramatic. But the body does not experience them in isolation. They combine. Sodium increases fluid volume. Low potassium reduces the body's ability to correct it. Sugar and insulin increase retention and vascular tension. Late meals prevent the system from resetting overnight. Together, they create a steady internal environment where pressure remains elevated. And this is why blood pressure can feel stubborn. It's not just one cause. It's a network of signals, all pushing in the same direction. Correcting another common assumption. At this point, many people start to think, so I just need to remove everything and eat perfectly. But that's not how this works. The goal is not perfection. The goal is awareness and adjustment. Because even moderate changes in these patterns can shift how your body regulates pressure. And importantly, these changes often work together in the opposite direction as well. A little less sodium, a little more potassium, more stable blood sugar, better meal timing. Now the body has a different set of signals, and it begins to respond differently. This is also where medication and diet can finally work together, instead of working against each other. But to make that practical, you need a way to apply this consistently in daily life. And once you bring these patterns together into something simple and repeatable, the picture becomes much clearer. Because blood pressure control is not about one perfect choice, it's about a pattern your body can rely on every day. At this point, you've seen something important. Blood pressure is not controlled by one food, one habit, or one decision. It responds to patterns your body experiences repeatedly. And once those patterns shift even slightly, the internal signals begin to change. What matters now is making this usable. Not complicated, not restrictive, but consistent enough that your body can rely on it. because consistency is what your cardiovascular system responds to. A simple daily framework for blood pressure stability. Instead of thinking in terms of good foods and bad foods, it helps to think in terms of balance across the day. Here is a practical way to organize that. 1. Build meals around potassium-rich foods. This does not mean forcing large dietary changes overnight. It means making sure that most meals include at least one source that supports vascular relaxation and sodium balance. Examples include leafy greens, beans and lentils, avocados, yogurt, fruits like bananas or oranges. These foods provide potassium, which helps your body release excess sodium and reduce tension inside blood vessels. Over time, this shifts the internal balance in a direction that supports lower pressure. 2. Reduce hidden sodium rather than chasing zero salt. Trying to eliminate salt entirely is not realistic and often not necessary. The focus should be on the sources that contribute the most without being obvious. Packaged soups, processed meats, ready meals, sauces, and even certain breads can carry a large portion of daily sodium intake. Small adjustments here, choosing lower sodium versions, cooking more simple meals at home, or checking labels can make a meaningful difference without requiring extreme restriction. This aligns with dietary patterns studied in the DASH diet trials, which show that reducing sodium while increasing nutrient-rich foods helps lower blood pressure. 3. Stabilize blood sugar across the day. This is often overlooked in blood pressure discussions. But as you've seen, insulin affects both fluid balance and vascular tone. The goal is not to remove carbohydrates completely. It is to avoid repeated spikes. This can be done by pairing carbohydrates with protein or fat, choosing less refined options, avoiding frequent high-sugar snacks or drinks. When blood sugar is more stable, insulin levels are more stable, and that reduces one of the signals that pushes blood pressure upward. 4. Give your body a quiet window at night. Meal timing matters more than many people expect. Try to leave a gap between your last meal and sleep. This allows insulin levels to fall and gives your cardiovascular system a chance to settle into its natural nighttime rhythm. Even a small shift, eating slightly earlier or avoiding heavy late meals, can help restore that normal drop in blood pressure during sleep. Over time, this supports better overall regulation during the day. 5. Keep patterns steady rather than perfect. This may be the most important point. Your body does not need perfection. It needs predictability. A consistent rhythm of moderate sodium, adequate potassium, stable blood sugar, balanced meal timing creates an internal environment where blood pressure is easier to control. Irregular patterns, large swings, inconsistent habits are harder for the body to manage, especially after 60. Medication and diet, working together instead of against each other. Many people rely on medication to control blood pressure, and in many cases, that is appropriate. But medication works best when it is not constantly counteracting opposing signals. If your diet is repeatedly promoting fluid retention, vascular tension, and hormonal activation, then medication is trying to manage pressure in a system that is continuously being pushed upward. When dietary patterns shift, even slightly, the same medication often becomes more effective. Sometimes, this allows for better control with fewer adjustments. And sometimes, under medical supervision, it may even reduce the need for escalation. The key point is this: medication manages pressure. Diet influences the system that creates that pressure. Both matter, but they are not doing the same job. What to pay attention to starting now. If you take one thing from this, let it be this: do not rely only on how you feel. Blood pressure does not signal clearly. It does not warn you early. Instead, pay attention to patterns. Look at how often you rely on packaged foods, how balanced your meals are, whether your eating pattern stays consistent, how late you eat in the evening. These are the signals your body responds to every day. And small adjustments here can change the direction over time. From a clinical perspective, this is where many people regain a sense of control. Not by doing everything perfectly, but by understanding what actually matters. A final thought from clinical practice. I've seen many patients reach a point where they feel stuck. They are taking medication. They believe they are eating reasonably well, but their numbers remain higher than expected. And in many of those cases, the turning point is not a dramatic change. It's recognizing one or two of these hidden patterns and adjusting them consistently. That's when the numbers begin to shift. That's when the system starts working with them instead of against them. If this helped you see your own situation more clearly, you can subscribe for more explanations like this, focused on what actually changes risk, not just what sounds correct. And if you're comfortable sharing, let me know which part sounded familiar. That helps guide what I explain next. The goal here is not to overwhelm you. It's to help you see what your body has been responding to all along so you can make changes that actually move things in the right direction.